Yeah, let me just introduce you,
Yes, you
Ray.
go for it. You go for it.
Hey guys, I'm really sorry for the delay, but hey, this is I think the waiting time is worth it because what you will have tonight, the explanation that you will have that's coming by one of the head of Nutrify, one of the person who fought that in association with the company, he is well known on his field. Is We love him here in Europe. He came a few times to see us, and this is an honor to have you tonight with us. And guys, I just want you to understand what the chance to have Dr. Strand with us. So please mute yourself on each line, guys, French and Hebrew. Don't forget to mute yourself and try to get as much as we can because that's a big value. So Dr. Strand, I give you the line. It's your show.
Okay. Well, thank you very much. I apologize. I tried to log on. Truly, I did. I was on time, but to be honest with you, it was very frustrating because it would not let me in. I hope, Isham, if you could look at my screen, is that sharing on or is it just my screen? Because I've got a sharing button that's right in the middle, and I'm going to try to. Oh, there I go. I got rid of it. Are you still seeing my screen? I guess that's what I want. Okay, I'm assuming you can still see my screen. Uh,
That's all good.
it's good. Okay. Well, let's get started. I'm sorry for the delay. I am very excited to do this webinar, and to be honest with you, it's a privilege to be able to share some knowledge about the health benefits my patients receive by taking RX Nutrify and how I approach nutritional medicine using these wonderful products. And I'm going to be going through some medical information to give you a better understanding of why not only Nutrify works and why Slenderize works, but also what is this concept called first step therapy. This is something that I want you to understand. So what we do is that you start looking at this, and we most people come in to my office because they're concerned about their weight control, and this is a big deal in the United States, and I'm sure it is in Europe and in Israel. But just to give you some US factors, about two-thirds of our adults in the US and a third of our children are now considered to be either overweight or obese. About a third of the Americans are trying to lose weight at any one time, and another third, or 30%, are trying to maintain their weight. Here in America, we are spending over $30 billion each and every year on diets and weight loss control plans. However, the medical studies that I look at as a physician show that if someone is able to lose weight at any time with a diet, two-thirds of those people actually gain all that weight back within 1 year. And in 2 years, 98% gained that weight back and much more. In other words, diets fail 98% of the time. So when RX looked at this whole situation, the last thing they wanted to do was to offer another diet plan that we know is only going to be successful 2% of the time. And so what we find is that we need to look at understand why diets don't work. You see, when my patients come into my office and they say, "Oh, Dr. Strand, I want to lose some weight. What do you recommend?" Or "I tried such and such a diet, but I either can't get the weight off or I gain it right back." Well, diets don't work because primarily they're a short-term solution for a long-term problem. Most of my patients who go on a diet will most likely come off that diet sometime in the future and usually return to those previous poor lifestyles and eating habits that got them into trouble in the beginning. But the main reason diets don't work is because they do not tackle the core issue, which we call insulin resistance, or as we learn, prediabetes or the metabolic syndrome. So what is insulin resistance? It's really the result of poor lifestyles and inactivity over a long period of time, which allows us to become less and less sensitive to our own insulin. Now, when this happens, our bodies compensate for this situation or problem by making more and more insulin. However, as your blood insulin levels begin to rise, you literally tip over into an abnormal metabolic state called prediabetes or the metabolic syndrome. So I, as a physician, deal with this every day in my practice. In fact, over 50% of the adults and about 30% of our children are in some stage of insulin resistance. So it's a very common problem in my medical practice, and it's significant. And this is what I'd like you to understand. So what is the consequences of this insulin resistance we call the metabolic syndrome or prediabetes? Well, what happens is you can't utilize calories normally, so you start to gain an unusual amount of weight around your middle. You start to see your blood pressure starts to go up. The cholesterol, the good cholesterol called HDL cholesterol, goes down, and your very bad LDL cholesterol goes up. The other fat in the blood called triglycerides starts to go up, and your blood sugars will eventually go up. But this constellation of problems, all of these, they are the result of underlying insulin resistance, or the fact that you're not as sensitive to your insulin as you once were. And so you can look at all these problems, which eventually leads to diabetes. But insulin resistance is basically the results of a poor lifestyle, which is inactivity and a poor diet. In other words, we are not active anymore and we're not eating properly. So our bodies, we find one of the greatest drugs we're putting into our bodies are the foods we tend to choose to eat. So this is leading to the major epidemics of both obesity and diabetes. And you're going to see how this fits in medically as we go through this. So let me just share a little bit more on why this is happening. This is something people do not understand. I've researched this for over 3 years back in the 1990s. I've been doing this in my practice now for well over 20 years. But what happens is that most nutritionists, registered dietitians in the United States, believe in a theory that was developed in 1901. That's over 120 years ago. This theory is regarding how fast sugars are absorbed. So you'll hear the term simple sugar versus a complex carbohydrate. So what we find is that we find that there's simple sugars are short chains of sugars. Let me back up, because you need to understand that carbohydrates are simply long chains of sugar. And the short chain sugars, like glucose or like table sugar, fruit is sucrose, we call it, is a short chain sugar, so we call them simple sugars. Now, the complex carbohydrates are like bread or flour, rice, cereal, pasta, potatoes, fruits, vegetables. So these long chains of carbohydrates we called complex carbohydrates. Well, the 1901 theory was the fact that the shorter chains of sugar would be digested quicker and your blood and would cause your blood sugar to rise much faster than these long chains of carbohydrates called complex carbohydrates. Well, in 1981, a researcher out of the University of Toronto in Canada named Dr. David Jenkins actually challenged this theory. And he put this theory to the test. He simply took his patients or his research subjects and gave them a particular carbohydrate. He might have given them a banana, or he might have given them white bread, or a potato, or rice, or red sweet cherries. But he would give it to them and watch how fast that blood sugar rise, actually by drawing blood sugar after these patients would eat these foods. And he compared them to glucose, which is what all of these carbohydrates turn into in the blood. So he gave glucose a glycemic index of a 100. And so what he did basically, just to kind of share what this is, he would take and give his patients glucose initially, and he would watch that rise in blood sugar. And this rise, he would say, since this is the natural glucose everything is becoming, he gave it a glycemic index of 100. Well, the sample food I use in this slide is sweet cherries. So then he compared the rise after ingesting the same amount of carbohydrates and grams of carbs or sugar in sweet cherries, but he noticed the rise wasn't as much. And so what he found is that compared to glucose, sweet cherries only rose at a 22% the rate of glucose. So sweet cherries received a glycemic index of 22. And this is what he did with every food. So a sample of this, these are just representative foods. So you see on the first one, glucose has a glycemic index of 100. Well, a baked potato had a glycemic index of 85. Cornflakes and all the cereals had a glycemic index of 84. Whole wheat bread, this is brown bread, had a glycemic index of 71. White bread had a glycemic index of 70. But here, look at the next one, table sugar. Now, table sugar is just that. It's just sucrose. It's table sugar, but it only had a glycemic index of 61. Now, this is what was referred to as a simple sugar. Well, look at some of the fruits and black beans. The peach, a whole peach had a glycemic index of only 28. Sweet cherries, like I said, showed you, was 22. Black beans are 20. So if you look at a glycemic index chart, we believe any glycemic index above 70 is a high glycemic index. You eat that kind of food and it's going to spike your blood sugar very, very rapidly. A medium glycemic index is 55 to 70. A low glycemic index we feel is lower than 55. So what we do is I want to show you this chart. Excuse me. In the United States, 80% to 90% of the carbohydrates we consume today are considered high glycemic. So if you look at that black line that goes all the way across, that is what we call your fasting blood sugar. After you've slept all night, you wake up in the morning before you've eaten anything. This is called your fasting blood sugar, and it's usually the lowest blood sugar of the day. And that that blood sugar is a baseline. So you wake up in the morning and you go out and you have a high glycemic breakfast, which could be cereal, it could be oatmeal, it could be a bagel, orange juice. But what happens is that blood sugar rises very, very rapidly. You can see here the blood sugar rises very, very rapidly, and a rapidly rising blood sugar stimulates the release of insulin. Insulin, its job is to control blood sugar. And so when that blood sugar is going up, you release a lot of insulin, and its job is to transport that blood sugar into the cell to either be utilized as energy or stored as glycogen or fat. But in the case of a high glycemic meal, we usually overstimulate the amount of insulin we release, and that blood sugar comes down just as fast as it went up. But look at here. If you keep following that red line, it drops below the fasting blood sugar, and it goes into the low blood sugar range, or what we call hypoglycemic range. Well, this stimulates the release of what we call our stress hormones, adrenaline, cortisol, and trying to drive that blood sugar back up to normal. Because if this blood sugar was allowed to keep going down, 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 you not only would get mentally confused, you would get a shaky weakness, and we've all maybe have experienced that, but you literally could go into a coma. So this blood sugar dropping stimulates these other stress hormones to drive the blood sugar back up to normal. Now, it does eventually come back there, but the trouble with this is that now in your bloodstream you have a lot of high levels of stress hormones. And what that does, it causes you to crave eating another meal, and you usually crave another high glycemic meal. So you keep doing this over and over, day in and day out. It's like hollering wolf, because we're doing it so much and we're stimulating our insulin over time, over 10, 12, 15 years. Your body just isn't as sensitive. It does not respond to the insulin like it once did. So the body compensates for that by eventually making more insulin, and that's when you tip over into an abnormal metabolic state. And so you start to learn that the foods that we have been taught to eat are the wrong foods, because we've been, if you look at it, our children are eating these high glycemic meals, and a gentleman named Dr. Ludwig actually studied a group of 12-year-old children, and he either gave them a high glycemic breakfast, which was actually instant oatmeal and orange juice, or he gave them the same amount of calories, a low glycemic meal, which was a veggie omelet and fruit. And then he said, kids, eat whatever you want the rest of the day. Well, what he found is the kids that had the high glycemic meal ate 80% more calories during the day than those children that were given a low glycemic meal. So spiking your blood sugar sets off this uncontrollable hunger. It's almost like a carbohydrate addiction. We crave this. So what we have been calling emotional eating and cravings all these years is really a normal physiologic response to a high glycemic meal or snack. And so this is something we're learning, that we start to overeat, we overconsume. And Dr. Ludwig went on to switch the children's groups, and then he switched what they ate. And sure enough, he found the same thing. It wasn't the type of children, it was the actual meal he was giving them. So what happens to you when you actually tip over finally into this insulin resistance or metabolic syndrome? You actually tip over into an abnormal metabolic state where you cannot use calories normally. You see, your muscles can no longer use calories normally. And why is that important? It's because our muscle normally takes up 90% of all of our calories and utilizes them as energy, but the muscle becomes insulin resistant. So many of the calories that should be used as energy are now diverted to the fat cells of the abdomen. And insulin's job also is to convert that glucose to fat in our fat cells of our abdomen and then block the release of that fat. Once you enter this state, not only cannot use calories normally, but you hold on to fat like a sponge holds on to water. And this is what I found out in the mid 1990s. I began to realize that the reason my patients couldn't lose weight effectively and they started to have all these medical problems I had to prescribe medication for was because they were becoming less sensitive to their insulin and tipping over into this metabolic syndrome. And they had a resistance to weight loss. This is what has been something I've been doing now for 20 years. And I want to just share with you that when I was doing this, I happened to be doing physicals on our local fire department, our local police department, and our local sheriff's department. So I would do physicals on these individuals every year. I would get lab work, I would measure them, I would do a physical exam. And so when I started to understand this metabolic syndrome and prediabetes, when I would see these people, I could literally go back and look at sometimes 10, 15, 20 years of physicals. And I started to realize there are early signs of insulin resistance. It takes years and even decades to develop. So what I began to do in my medical practice is I wanted to look for early signs so I could treat this more effectively quicker before they started to have trouble. So what I started to notice is an expanding waist size was all I looked at. If my men had a waist size over 36 inches, I started to be concerned. If my women had a waist size over 32 inches, now I know you use metrics in Europe and that you'll have to convert that. But you know, just when their waist size started to get bigger, I became concerned. If I did blood work on them, or if your doctor has done blood work on you and say, well, your good cholesterol is real low, well, then I started to get concerned. Or the other fat in the blood, the triglyceride going up, if that's increasing, that's not a good sign. And then my patients would start to see a little bit creeping up in their blood pressure, and their doctor may check it 2 or 3 times. But it's something that I notice very quickly because I'm doing this in my medical practice. And eventually their blood sugars would go up. And so I began to diagnose prediabetes very early. And I started doing this in the 1990s. And I was able to reverse it. I'm going to share how this has led to first step therapy and how Nutrify has taken this role in really trying to help people protect their health. So this is a graph that was given to me by a drug company. And I want to explain, this graph here is 25 years in time. Now you could go back where it says normal there. You could go back another 10, 15 years because you don't all of a sudden wake up one day and have the metabolic syndrome or insulin resistance or prediabetes. You don't wake up one day and, oh, I'm diabetic. It takes time. It takes decades to develop. And so because of poor lifestyles, here after 10, 15 years, your body eventually tips over into what is called insulin resistance. Like I've shared, you're just not as sensitive to insulin as you once were. And so what happens is as your body becomes more and more insulin resistance, the body compensates for that situation by actually producing more and more insulin. So blood insulin levels go up. Insulin production, the green line on this graph, you see it going up. But as long as these two lines parallel, you'll see blood sugars basically stay normal. But after 10, 15 years of this, the body can't keep making that amount of of blood sugar. So insulin production will eventually fall down. It just wears out. And then whoops, there goes your blue line, your blood sugar going up. And it's about in here, about 15 years after you've developed insulin resistance, you actually diagnose, or I diagnose a patient as being diabetic. But remember, as insulin levels go up, your blood pressure goes up. You gain this unusual amount of weight around your middle. Your blood sugars will eventually go up. Your blood pressure goes up. Your cholesterols go up, and you start having all this problem. But what the underlying thing is, you start aging much faster than you should. Your arteries literally are aging about 30% or about a third faster than they should. So for every third birthday, add another year of age. Because when you're in this, then what happens is you just start aging much faster. So that's why I feel it's important that we diagnose this prediabetes early and correct it, because it's much easier. When my patients become diabetic, at the very first day, I actually am able to diagnose someone in my medical practice as being diabetic. Over 60% already have major cardiovascular disease or hardening of the arteries. That is why 80% of our diabetic patients are dying prematurely from what we call a cardiovascular event. That's an event like a heart attack, a stroke, or a ruptured aneurysm, because your arteries have aged. And the reason is we don't begin treating these patients until they've already developed horrible disease, because they started aging too fast back here when they first tipped over. And the medical community has now said, boy, we should be treating this prediabetes or this early diabetes as aggressively as we do a patient with diabetes. And all of our diabetic specialists got together, and they came together and they had what we call a consensus opinion. They trying to guide physicians what to do. And that opinion was published, and I have copies of it. But what they say, drugs do not help in this situation. Now, yes, when that blood pressure goes up, the doctor will prescribe a high blood pressure medication. When their cholesterol goes up, they'll prescribe a cholesterol lowering drug. I mean, they prescribe medication, but it does not improve insulin sensitivity. And many of these drugs actually make them worse. So what they decided is we need to treat by giving our patients intensive lifestyle changes. This is what the treatment is. That is first step therapy. This is what Slenderize is. That's what Nutrify is. It is treating early. It is first step therapy. What it is, it's in firmly establishing healthy lifestyles that improve insulin sensitivity. Doesn't it make sense? Since it's poor lifestyles that cause this problem and gives us all of this, then perhaps maybe healthy lifestyles that actually improve insulin sensitivity could reverse this problem. And this is what I did for 3.5 years researching the medical literature. What lifestyles actually help improve insulin sensitivity? And that's what I did. And that's when I started to give my patients a triad of healthy lifestyles that actually improve insulin sensitivity, documented by our medical literature. So this is very important. Since insulin resistance, I'm going to review this, is a result of poor lifestyles, it only makes sense that firmly establishing healthy lifestyles that improve insulin sensitivity is the answer. This is the foundation for your transformation. And RX is first step therapy. Nutrify plus Slenderize. Now, trust me, we also have the endorsement of the medical community. The medical community has said all of our patients need a trial of healthy lifestyles before beginning drugs in many situations. So if I have a patient in my office and I find out, oh, they have early high blood pressure. You know, their blood pressure is going up, or they do have prediabetes, or they even have early diabetes. They have elevated cholesterol, or they might have early heart disease, or early osteoporosis or thinning of the bone. They deserve a trial of healthy lifestyles, first step therapy, before they begin taking medication, which we refer to as second step therapy. In the United States, we have a lot of advertising on cholesterol lowering drugs or statins. And I always point out to my crowds in the United States, listen to those ads, because what they always say is, whether it's Crestor or Zocor or Lipitor, doesn't matter what the drug is. They'll say, when diet and exercise fail, then you should start our drugs. Why do they do that? It's because our FDA has not approved those drugs for first step therapy. They are only approved for second step therapy. Now, trust me, I'm a physician. I still prescribe medication, but I use medication as a last resort, not a first choice. Now, many doctors don't do that. They just give lip service to lifestyle changes because, number one, they don't think their patients will do them, or that they can, make those changes. Or even if they do it, they don't think they'll be clinically effective, and I'll have to write the drugs anyway. So you don't see this really supported. But this is the role of companies like RX that have developed these products. And I'm going to share how they have made it easier for my medical practice in helping my patients with any of these and all these problems. Because, if I get them to allow them at least 90 to 120, maybe 120 days, I can significantly have an effect on their health. And they either are able to avoid medication altogether, or definitely be less dependent on medication. In other words, they need to use less medication. So what is RX's first step therapy and the Slenderize program? Well, to me, it's a 4-part comprehensive lifestyle program. It is not a diet. I've shared with you, diets don't work. In other words, we've got to make these lifestyle changes the rest of our life. And so I'm going to just go through these briefly so you understand better what you're accomplishing and why it works to put it all together. So the 4-part program is a healthy diet, and it's one that does not spike your blood sugar, and I'll explain this. Modest exercise, not superstardom, not being a marathon athlete, just modest exercise. Nutritional supplements, Nutrify, and the day and night drops. But each of these lifestyles have been shown to improve insulin sensitivity from a different mechanism. Now, that's a key point I want you to understand. When I get my patients and I share and I diagnose them with any of these problems I've shared with you, and I always say, well, I can write medication, I can write a drug, you can do that. Or you could try healthy lifestyles and try to avoid medication, or at least be less dependent on medication. What would you like to do? Well, about 20% of my patients say, oh, Dr. Strand, just write the drugs. I don't want to make any changes to my lifestyle. Well, fine, I can practice like almost every other physician does. I'll write the medication. But about 70 to 80% of those patients will say, Dr. Strand, I would do anything to be able to avoid medication. What do I need to do? And my patients always said, but if I'm going to spend my time, my money, my effort to try to improve my health and lifestyle, I want to know that it's going to be clinically effective. There is so much garbage out there. There's so much people telling you anything. And I just want you to know that I am basing, and RX bases their first step therapy program on medical science, on third-party medical literature. Now, my book, Healthy for Life, has been translated into French. I don't know if it's there. I think it's on Amazon on your French. But I want to draw your attention. In the back of the book, I have over 30 pages of medical study references that I researched so that it's scientifically based. We've got support from our diabetes specialist called endocrinologist. And in the fact we need to be teaching our patients intensive lifestyle changes. Well, the problem is physicians are too busy. They don't believe this. They don't have time to do this. So it's companies like RX that turns around and says, yes, this is what we need to do. Here is a role. We are concerned about health. It's much easier to protect your health than it is to try to regain your health once you've lost it. And that's where I am, and that's why we are here. So, what is a healthy diet? What am I talking about? Well, a healthy diet is simply defined as eating those good carbohydrates. Now, those are carbohydrates that do not spike your blood sugar, with good proteins and good fats. There are bad proteins and there are bad fats, and I explain all this. But we're teaching those. That's what we're trying to do. But your main enemies, the things that are destroying your health, are all of these processed grains, flour, cereal, rice, breads, pasta, potatoes. Uh, these spike your blood sugar faster than if you're eating table sugar. I just showed that to you with the glycemic index studies. So these are your enemies. Now, what is recommended is eating whole foods. The more natural the food is, the more whole it is. This is key. The more food is processed, the worse it is for you. For example, if you take whole oats and you soak them overnight and you eat them in the morning, they are low glycemic. If you take slow cooked rolled oats, they have a medium glycemic index. But then if you do instant oatmeal, they have high glycemic index. The more it's processed, the worse it gets. Another example would be an apple is very low glycemic. Now, applesauce, uh, it has a little higher glycemic index, but it's better than apple juice, and the apple juice is better than the sweetened diluted apple juice. The more man processes food, the worse it is. So when you go into a grocery store, and I'm sure this is true in Israel, and I'm sure it's true in France, you go on the outside where all the natural, where the apples and the oranges and that. If you have to look at a label and it has more than one item, that's processed. Okay? You want to, the more whole foods you can eat. But it's learning to eat in such a way as you do not spike your blood sugar. And you consume those good fats and good proteins. And I'll share, this is just a picture of the USDA food pyramid. This is our food pyramid that is recommended by our medical community in the United States. Now, I don't know about France and Belgium. I don't know about Israel, but I'm assuming it's going to be similar. The United States has a lot of influence. But you look at the top, what the top of the pyramid, what's there? Well, it's fats, it's oils, it's sweets, it's sugar. Okay? What's at the base of the food pyramid? It's bread, it's cereal, it's rice, it's pasta, 6 to 11 servings. Well, my goodness, I've just told you, these are the worst foods for you. These are worse than the sugar. So so what should the pyramid look like? It should look like this. At the base should be whole fruits and vegetables and nuts and legumes, and then eating those good omega-3 fats and the monounsaturated fats and really keeping down still the sugars, but really eliminating all these processed grains. And this is where we need to be and understand that these aren't good for us. Now, I showed you the red line, when you eat a high glycemic meal and what happens, but what happens when you eat a low glycemic meal? Well, that's the green line. You wake up, you still have the same fasting blood sugar, but the green line goes up and your blood sugar goes up very, very slowly because it's low glycemic food. That would be like a veggie omelet and fruit or something like that. Well, what you'll find is that, yes, you stimulate insulin, but you don't overstimulate it. And the insulin is stimulated, but then the blood sugar comes down slowly back down to this fasting blood sugar. You're hungry again, but you're not craving all these foods. So you eat another low glycemic meal, and that blood sugar goes up again slowly. That's the key. The medical literature shows you have just one low glycemic meal, and your blood insulins begin to drop just with one. After two, it drops more. But that same medical literature tells us if you spike your blood sugar and then you set off this, drops down in the low blood sugar range, and you set off these stress hormones, that sets off uncontrollable hunger for 2 to 3 days after one high glycemic meal. So when you're craving food or you're thinking I'm hungry, well, you may have messed up the day or two before. So this is the secret. This is where it is. You start eating this way, and your natural appetite comes down. My patients, depending on how much insulin resistance they have, within 5 to 10 days, they come in and say, Dr. Strand, I can't believe it. I'm not hungry. I feel great. I have more energy, more focus. I don't have to rely on willpower. I just feel so much better. I'm not craving this dumb high carbs. Now, RX put together, and Deanna Latson and I worked on this for quite a while because it is really critical to offer people Pure Nourish. Pure Nourish is key for success. Now, I'm assuming this is available in France and in Israel. If it's not, you want to get it because Pure Nourish, you can put 2 scoops into water, almond milk, or coconut milk, along with some frozen fruit. And in my practice, when I'm dealing with people, I have them do 2 meal replacements a day. And then, because then they're combining, Pure Nourish is combining those good carbohydrates, those good fats, and good proteins. It is not only GMO free, gluten free, dairy free, and soy free, it's also low glycemic. It is a behavioral modification tool. It allows you or my patients to easily experience a healthy diet that does not spike their blood sugar. Then all I have to do is I want to teach them how to eat at least one low glycemic meal, a regular meal, and 2 low glycemic snacks. And they do this, and I've done this, and I'll tell you, they notice a difference within 10 to 14 days. They can't believe it. And this is what's key. And I use Pure Nourish. You can add the Power Boost and the Beauty Boost, all you want. Doesn't matter. They're all low glycemic. But you can mix different fresh or frozen fruit. Remember, all whole fruit is low glycemic. It is not a problem. So then I go on and I try to encourage my patients to exercise. Now, what we have found is you do not have to be a superstar, but I want my patients to build up to 30 minutes of modest aerobic activity 5 days per week. I don't want them to do it once a week, and I don't want it to do 7 times a week. I want them to exercise 5 times a week. The medical literature shows that if you can build up to this or do this, you significantly improve your insulin sensitivity from a different mechanism. Now, this could be brisk walking, riding a bike, swimming, hiking, playing tennis. It doesn't matter. Just so you're moving the body. The only thing the body cannot handle is inactivity. You just got to build up, and if you're out of shape, you got to take your time. But aerobic activity, now I'm not talking down stretching or weightlifting, but the aerobic activity is key to improving insulin sensitivity. It is a major aspect of any healthy lifestyle. Now, nutritional supplementation improves insulin sensitivity. I have looked at hundreds of studies that have shown, they study one nutrient at a time. They'll study vitamin C, or they'll study vitamin E, grapeseed extract, magnesium, chromium, vitamin D, along with many of the other minerals and antioxidants. And they show that they all individually improve insulin sensitivity, again, from another mechanism. And so what we find is that even though studies are there, what I have learned in my medical practice is how do I use this Nutrify line of products and first in my first step therapy. Well, everybody has different needs and different desires. And so I'm going to give you some approach of what I do in my medical practice. What I do is I have a concept of cellular nutrition. Now, all of these studies that are done primarily look at one nutrient at a time. And the amazing thing is that over 90% of these studies that look at single nutrients show some health benefit, and many of them show improvement to insulin sensitivity. So I have all my patients start cellular nutrition. That's providing all of the essential nutrients to the cell at optimal or advanced levels, not RDA levels. These are levels that have been shown to provide a health benefit in our medical literature. That's what's based. That's how RX has put together optimal M and optimal V. They've just put them all together. And I list in my books what your doctor doesn't know about nutritional medicine. I have 2 pages of what I recommend. Well, the overwhelming majority are in the optimals. My patients looked at those books, or readers look at it, and it scares them. Well, jeepers, you just take optimal M and optimal V in the morning with food and again at night. And you have cellular nutrition. This is my baseline. Now, I know a lot of people, well, let me share this, why this works so well. It's a concept called synergy. Here's what happens. Antioxidants work in different parts of the body against different free radicals. Now, vitamin E is your best antioxidant within the cell membrane. Vitamin C is the best antioxidant within the plasma. Glutathione is the best antioxidant within the cell itself. Well, all of these antioxidants need the so-called B cofactors, that's vitamin B1, 2, 6, 12, folic acid, to do their job. They need that. They also need the antioxidant minerals, selenium, copper, zinc, all of these to do their job. And if we're short on any of these, our bodies can't function at its optimal level. Well, the other thing that you realize is vitamin C has the capability to regenerate that vitamin E, so it can be used over and over and over again. There's another antioxidant called alpha lipoic acid. It's a wonderful antioxidant that's put in the optimals, and it regenerates both vitamin E and that intracellular glutathione. So 1 + 1, when you add these together, is not 2. It can be 10, 20, 30, 40. And that's why I see such wonderful health improvements in my patients using the Nutrify brand. And so this concept is something that you just don't understand. And companies just don't put this together properly. It's got to be balanced. It's got to be the highest quality raw products. And it's got to match the medical literature. So we're giving optimal levels. RDA levels, I'm just going to go in here because I know Europe struggles with this a little bit. RDA levels were developed during the Second World War as the minimal amount of nutrient needed to prevent what we call nutrition, deficiency diseases like pellagra, scurvy, or rickets. It has nothing to do with the chronic degenerative diseases. So, RDAs aren't enough. So what I do and how I approach nutritional medicine is at the base of my nutritional recommendations is cellular nutrition. Now, I like the optimals. A lot of people in Europe like MOA. And when I go over there, I try to get them to at least add the minerals to MOA. Now, MOA has tremendous number, 36 superfoods. I mean, it's a wonderful nutrient. And when you put the optimals and MOA together, it's like Batman and Robin. I mean, they just become more potent. And so I like them together. And if economics is a problem, well, at least MOA and taking the minerals, because there's not adequate minerals in MOA. Now, a lot of people aren't getting in enough omega-3 essential fats. 80% of Americans don't get enough essential fats, but they can get it from their diet if you're eating a lot of cold water fish and that. So it's not essential, but to many people, they want to take their fish oil. And so I'll add omega Q for those people. Other people, women especially, are concerned about thinning of their bone. We call that osteoporosis. And they want to add Magna-Cal-D. Well, that to me is the base. That's cellular nutrition. That's the base, and they can do it. Men, it helps rhythm problem of the heart. You get your good doses of vitamin D. And so those are all good. But the way I look at Venali, BioPro-Q, Restorix, and Rejuvenex as more of enhancers that I add to my cellular nutrition. I don't want people just taking Rejuvenex. I'd like them at least taking MOA and Rejuvenex, better optimals in MOA. But the same thing, BioPro-Q is a wonderful enhancer. And you get some CoQ10 and omega Q. But a lot of my patients who are concerned about heart health or their immune system or building up that, they want to take it. Venali is the most potent antioxidant that we're aware of. It's 50 times more potent than vitamin C and vitamin E. And many people want to add Venali because it's a natural anti-inflammatory. It's a natural anti-allergen. It penetrates all the tissues of the body, and it's wonderful. So basically, I add these, and some people take them all. That's fine. Restorix is able to detox the body. Remember, if you're losing weight and you're losing fat, that's where a lot of the toxins and heavy metals are stored, and you're releasing those. A lot of people like Restorix when they're making these lifestyle changes and losing weight. And so they'll add that, and they actually are able to lose weight faster because it takes the acidity out of the body. It makes your body more alkaline because it's taking out these heavy metals and toxins. But that's what I do. And everybody can look at this and just see this is how I approach it. And I really look at it. But how do you optimize success? And I just want to review this. So my patients who have had the greatest success and when they firmly establish all three of these healthy lifestyles, a healthy diet that does not spike your blood sugar, modest aerobic exercise, and nutritional supplementation, at least cellular nutrition. And what I found is if I could get my patients to make one of these lifestyle changes, I don't care which one it was, I saw some health improvement. If I could get them to do two of the three, again, it didn't matter which two, they improved a little bit more. But if I could get them to do all three, the results were simply phenomenal. I have now used my medical approach in 3 different clinical trials. They've been done under the guidelines of the FDA. The last one was published. And what they found is we could take people who had prediabetes and actually reverse it. And so by improving, their insulin levels dropped 50%. And this was key. Now, because of RX, I'm adding the day and night drops, which gives you support that allows you to make these lifestyle changes more easily. And there's even some evidence that it may also help improve insulin sensitivity from another mechanism. So this is my approach. This is what I see. I'm bringing up this graph to you again, because in those clinical trials I just mentioned, we were able in every one of the clinical trials to drop blood insulin levels by 50%. So all this blood insulin, as insulin sensitivity improved, the blood insulin levels went down. Well, it reversed all this. So as blood insulin levels go down, your blood pressure improves. Your triglycerides, that other fat in the blood, improves. Your cholesterols go down. Your good cholesterol goes up, and your blood sugars go down. And you start to lose weight. You start releasing fat because blood insulin level or insulin, we call that our storage hormone. And as blood insulin levels go down, you just start releasing fat. My patients say, "Jeepers, Dr. Strand, I feel great. I have more energy, more focus. I'm losing weight. I don't know why. I'm not because I'm not relying on willpower. I'm just doing what you say." And lo and behold, my health parameters, my blood pressure, my blood sugar, my cholesterols, they're all improving. Well, that is first step therapy, folks. That's what we're talking about. So, RX realizes they've had to produce the best quality of nutritional supplements. You don't just get these kind of results with just fly by night stuff. I know that because I write my books generically. And a lot of people say, "Well, I didn't get the results you've seen." Well, I can't promote a particular brand in my books because then people start thinking I'm trying to sell them something and they don't listen to my health concepts. And that's why I can share this with you. And that's why I go around the world sharing this information. So let me, so these are the health benefits that people who want to do this can see. First of all, they won't see their blood insulin levels significantly decrease, but you are literally tipping back into a normal metabolic state. This allows the transformation that everybody is looking for. Improved blood pressure, improved cholesterol and triglyceride levels, blood sugars improve. You can establish your healthy weight permanently. This is not a diet. The reason that excites me is I've seen so many people lose weight, gain it back, lose weight, gain it back. It's unhealthy, but you can lose it permanently because you are correcting the underlying cause of the weight gain in the overwhelming majority of people. And and so you start to lose weight, you're healthier, you're less dependent on medication. And I'll tell you, you're going to hear stories. People will come up to you. You'll hear them every time. "Jeepers, my doctor took me off this drug, or he took me off that drug, or I'm even diabetic and I did this plan," which is fine. They just got to watch their blood sugars closely because they will come down. And they've got to be talking to their doctor because he will start backing off medication. And this is what we have found. So my book, this is the English book, but I know that it's in French. It's not in Hebrew, but this is something that I have all the documentation I've written, and I've got all the medical references and research. It is well documented. This is not just something I think about. This is in the medical literature, and I document it very well. Now, this is the book, What Your Doctor Doesn't Know About Nutritional Medicine. It has been translated into Hebrew. It's been translated into French. Now, I know that Anna has made available my other book called Bionutrition in French, and it goes over a lot of this information. But I have an entire chapter in this book in regards to diabetes and the obesity epidemic. And I wrote this years ago, and everything is still the same. So I just want to share, you've got some references you can look at and see. But I'm going to leave this slide up a little bit as I finish here. I do have two websites. The problem is they are in English. Now at raystrand.com, I do have about 30. Well, I give my specific, or I give my generic nutritional recommendations for over 100 different diseases. Now I've translated about 30 of those into French. So there is some there in French, nothing in Hebrew, but you get daily health nuggets from me. You get some newsletters, but you also start to understand when someone comes to you that might be suffering from, let's say, heart failure, or maybe actually diabetes or rheumatoid arthritis, or or other diseases, I give my specific recommendations that I've found in nutritional medicine. Now, I can I make this generic because I cannot put up RX nutrients and what I recommend specifically, because then our FDA here in the United States looks at that as a disease claim. Now, the other site that I want you to look at is healthyforlifeprogram.com. Again, it's in English, but if anybody can understand English, they would really do it. So that's where we are, and that is free. This other one is my online medical practice, but I just thought you might want to see those, even though they're just in English mainly. So thank you, and I'll welcome Isham back, and at least we got through it. I hope we didn't run out of time.
No, thank you, Dr. Strand. It was fantastic. Thank you so much for your time, guys. I hope you took some notes, and don't worry. You should receive in the next few days the recording with the presentation with that recording, so you will be able to see all of that, and you will be able to learn from that. So hey, just have a nice evening, have a great night, and I catch up with you very soon. See you guys. See you, the Dr. Strand. Thank you so much.
Thank you.
Thank you.